Welcome to Sterling Visionary Voices, the podcast dedicated to bringing you diverse, innovative leadership insights and actionable strategies for success. Join hosts Laura McNeil and Bob Medeiros as they explore the art and science of role model leadership through thought-provoking conversations with real professionals. Whether you're a seasoned leader or aspiring to excellence, Sterling Visionary Voices is your guide to navigating the complexities of your leadership journey.
Customer service excellence is about curating the best possible experience before, during, and after engaging with each customer. This is easier said than done. What one customer perceives as excellent service may very well be perceived by another customer as simply good service or service that's neither great nor poor. With us for this episode today is Debbie Vass, registered nurse for 30 years and Vice President of Quality Initiatives for Patient Care EMS. Thanks for being here with us today, Debbie. Wondering if you could start with some insights in regard to defining who our customers are before we get started.
Thank you, Laura. I appreciate the opportunity to talk with you today. I love this topic because customers are at the center of everything. So who are customers? Well, first of all, not everyone can be your customer. A lot of organizations start off thinking they have to be everything to everybody, and then you're not what you need to be to everybody. So it's really an exercise of determining who you want. You get to choose who your customers are in many cases. If you're in a public sector, maybe you don't get to choose your customers, but they're defined to you, who they are. They're citizens, taxpayers, etc. But this is why Starbucks has their niche group of customers versus Dunkin' Donuts has their type of customer. Even I've been to different gyms to work out in, and back in the day, I would go to Gold's Gym because my role as being a paramedic, I needed to lift heavy patients, so I wanted to be fit and to do that. So I would go to Gold's Gym. And they didn't have classes and spin cycles, and that wasn't something that they were out to do. They weren't going to add it for customers that wanted that because that's not what they were trying to be as a gym. But then you have all the other fitness centers, Esporta, LA Fitness, Crunch. They all have what it is that they're focusing on. They're not, some are adding classes, some may not. Some add 24 hours accessibility, but some don't want to spend the resources for that. So you get to determine who your customers are in many cases, unless of course you're in that public sector like myself. I don't get to choose the customer, but we do everything we can to make sure that we're meeting their needs.
Interesting. Okay. So not everybody needs to be your customer is what I'm hearing you say, that it does make sense to choose who you want to serve and to define to be your customer so that there's clarity in focus. Is that right?
Exactly. Focus. Key is the word here. Who are your key customers?
All right. So taking that into consideration, we now have key customers. Can you define to us or provide us some guidelines on how we might consider creating excellence in customer service for our key customers?
Well, it's important to start with what you want to achieve regarding the level of customer service excellence that you're striving for. So leaders need to define what they feel service excellence or customer engagement is. What does customer service excellence look like in your organization? And how do you know if you're providing service excellence and meeting your customers' expectations if you haven't really defined what those are? A lot of companies' vision or mission statements use words like world-class, premier, provider of choice, etc. But how do you know if you're close to achieving those visions or missions? So that's first. Leaders need to translate their vision or mission statements into performance targets and create the culture that supports the behaviors they believe contribute to providing service excellence. At our Sunstar operation in Pinellas County, for example, we focused on patient satisfaction, and that's what we got, satisfied patients. We achieved 99.8% satisfaction in 2017. But then we really began to focus on our vision of being the preferred provider. So we strived for patient engagement, which we define as a percentage of top box strongly agree responses. We started at 59% back in 2017. So when we were at that 99.8, hey, look at us, we got satisfied patients. We were only at 59% for patient engagement. But in 2022, Sunstar, in collaboration with our first responder partners, reached an all-time high of 87%. And also, we measure the Net Promoter Score, and that rose from the 70s to 90.
Even though you had high satisfaction rates, your engagement level was not really reflecting or not commensurate with the high level of satisfaction. Your engagement levels were much lower. And then you adopted, some changes which rose the engagement level and also had a direct reflection in your Net Promoter Score. So the Net Promoter Score process that you guys adopted, is that commensurate with what Fred Reichelt's book proposes through his book is called The Ultimate Question? Is that the same methodology you adopted to help you enable these changes?
Yes, we base it on that likelihood to recommend question. And the real important piece is that follow-up question of why did you rate the number that you rated? So if you are a promoter 910, why did you promote as a 910? Why did you give us that rating? Or if we're a distractor, why did you make those comments? And that's where you really get the learning, is to understand what are you doing that you're doing well and you should continue to do, and what are the areas that you could focus on of improving.
So that actually helps in understanding what customers really want in order for them to remain engaged with your organization. Interesting. So is there anything else then you can provide to the leaders who are listening in today that might help them in achieving a similar process for discovering what their customers really want? Any other thoughts on that?
Well, it may sound simple, but you listen to your customer, and you may hear that term, the voice of the customer. And that's really all the ways that you develop as a methodology for learning and listening to your customers' expectations. And one of the popular ones is surveys. You can have focus groups, social media posts. Some folks actually have a full-time position where they monitor social media to see what things are being said about their organization or competitors of their organization. Direct observations, that undercover boss thing I've heard you talk about before in your other podcasts. That's a way to make observations. But I want to mention one way that a lot of leaders really don't consider, and that's to ask your frontline employees who deal with customers on a daily basis. You can have focus groups with your employees that can reveal processes that you might have in place that are serving your business needs, but they're not providing good customer service. I remember this scene in the movie Meet the Fockers, where Ben Stiller's character has to catch a flight. And he gets there, he's a little bit late, but he's trying to board. And the woman won't let him board yet because she has not called all the sections, the zones that they called. You're now in we're boarding zone 3 now and zone 4. She wasn't even acknowledging him because she had to make it through all her zone calls before she said, okay, sir, you can go on the plane. And it just made for a funny moment and a really good example of where we have a process that doesn't make sense in that situation. And why would you follow that?
That was a hilarious part of the movie. And I think I saw the movie. I remember that part, but I never really translated it to a good depiction of what customer service is. He was not even being respected as a customer in that situation. And I think that's your point, right? She was not even acknowledging another customer was in front of her because she was so bent on the task at hand.
Yes, exactly. So you would be surprised too to learn, by listening to your customers, to find out They don't have to be wowed. Most customers would probably agree that more than anything, they want quality and to have an easy or painless service experience. If you're in the public sector, you aren't typically providing a product, but rather a service. And whether it's public health agency, property tax collectors, or in my case, the provider of 911 and non-emergency ambulance services, you're providing services to the citizens or taxpayers, and making these services as accessible and user-friendly would probably rise to the top of the list of things that they were expecting and wanting from you.
Yeah, I agree. So, how do organizations then ensure that when their customers walk away, they're walking away from either a service situation or a situation in which they purchased a product and they've got a positive perception of what they just invested in? Any thoughts on that?
Well, I'd say one strategy for improving the customer's perception of your service is to look for the pain points, the common complaints or common mistakes. Comb through that data if you collect that, and you should collect that so you can find some common themes there. But for example, ATM machines used to give you your money and then they would give you your debit card back. And this sequence resulted in customers driving away without their card, which was then sucked back into the machine to be retrieved later. And I know all about this because it happened to me. But now, you take your card before you get your money because you're not going to drive off without your money. Yeah. Another thing I've seen is receipts for self-service checkouts come out down where your knees are. So if you're really wanting to provide that customer with a receipt so they have it to make a return later, they've moved them up to be higher, more visible, or they put text or voice prompts for you to take your receipt. I can think of, the last time I went to renew my driver's license, and it's been a number of years now. But there were signs everywhere about what documents were required. The signs were in the parking lot. And I hadn't done any research to know what was required to renew my driver's license. And I didn't know I needed 2 forms of identification or proof of where I lived. But it was clear to me by seeing all those signs that they're trying to avoid this situation where you wait in line for 30 minutes and then only to find out you don't have what you need to complete what you were there to do. So that's a process that they created to reduce that pain point of that angry customer waiting in line and then not being able to do what they wanted to do and having to go home. For me, I saw the sign in the parking lot. I turned around. I went home. I got what I needed to make it happen. So I really praise them for doing that.
But I wonder if they could have made it a little bit easier for you to know without having to drive to the parking lot, right? Maybe there was a way, if they knew you had made an appointment, or maybe you didn't have an appointment, but wonder if there's a way for them to engage proactively with you before you even got to the parking lot.
Well, like I said, this was a while ago, and I think they have done more about putting it right up front on their website and any mailings that you have to renew what you need to do. So, that was bad on me, and maybe they didn't have that type of communication back then. But now, they again, just like an organization, they're evolving, they're learning. As pain points come up, they're constantly adapting to the new customers' expectations. I also think about accessibility, and like you said, that part of being communication are big wins with customers. Some examples of this are the kind of back to the DMV. They put kiosks in some of the public stores to make it convenient for you to renew your driver's registration. Another thing that's becoming really popular are more popular, I should say, are patient portals that improve communication and provide that near immediate results that we all want. Give me that results now. Research, including an article in the journal Medical Internet Research, has shown that patients who interact with their healthcare providers through a patient portal are more likely to continue with the same providers. I'm one of those people. I love that my physician has gone to the portal system. They're very engaged and active in it. And it's because of that, I don't have a reason to leave that practice. So I'm one of those folks.
Yeah, patient portals are really big. Every provider I have has a patient portal.
But they have to use them, right?
Exactly.
That's a big fail point too, is you've given me all this accessibility, but I send a message through it and I don't get a response. So you can have it, but you have to utilize it.
It has to be utilized on both ends. If you introduce a patient portal and your customers are not aligned with or receptive to the use of the portal, then it defeats the purpose, right? It's not really an avenue for engaging in a customer and engaging with a customer. And in certain situations, it might be perceived as a dissatisfier for a customer.
Absolutely. You set the expectation and you didn't deliver on the expectation. And that's a big pain point.
Let me pull the thread on that one too. Any thoughts on how leaders could strategize on enhancements to improve the connections that they create that align with customer expectations? Any thoughts on that?
I think to improve, well, to improve, you have to know how you're doing. So, one of the best practice methods is to review a performance scorecard that has customer satisfaction and engagement measures. If you know what your customers want from their experience with you, then you can develop methods to measure how you're doing in these areas. We talk about customer satisfaction or engagement measures, we automatically may think of surveys, and surveys are great and they're used a lot to capture customers' perceptions of their experience with the organization. Those questions may be asking how well the customer felt a particular requirement was met. For example, the paramedic listened to me and explained what they were doing.
So are you saying that part of the customer service engagement model should be focused on sensing what customers are feeling and how they perceive that you are connecting with them and fully understanding what they're sensing?
Well, yeah, in our situation, we know that customer, what our patients are wanting from us. We ask them and we learned that they want us to be caring and professional, and they want us to listen to them and explain to them what we're doing. And that's, building trust with our patients. And we know we have to do that well. So understanding their perception of that is very vital for us to provide that level of service back to them and meet their expectations. I'll mention too on this, all of our employees get feedback on these patient surveys. So every 6 months they get a scorecard, and we also do posters and whatnot that share how what our patient perception is of the care they are providing. We give them basically the answers to the test questions. Here's what your patients expect of you, and here's how your patients feel that you're doing. And it's drilled down to that employee will say, oh, for this 6 months, 5 of my patients provided survey results, and this is what they said about my care, and these are the comments they made about it. And that is very powerful. And I think that's one of the things that has helped us move from that satisfaction to engagement is by, sharing all this information with employees, of communicating with them, going over it with them and reporting back to them. It's something that they're really, they just love it. And I think it's really impacted our engagement scores.
Yeah. So if I can summarize all of this, I'm thinking there's 2 things that I'm taking away from it. One is it's not about customer satisfaction. It's really about the continuum from satisfaction to engagement and engaging with your customer on a deeper level where they feel that you really do understand them, that you understand what they're sensing, what they're feeling, and what their needs are. Secondly, I think the big thing that you highlighted with the ATM machine and the self-service checkouts, it's not about wowing the customer, if I could use your words exactly. I think I heard you say that. It's more about making it easy for the customer to do business with you so that they will come back to you because that was easy, right? The easy button, that was easy. Let me go back there because that was easy, right? So it's two. You respect me, you understand me, the whole, the meet the Fockers, at the boarding gate, you need the attention of the person calling out all the zones, and you can't get it, right? And then it's also the making it easy to do business. So I think that's good. Did I get that right? Those two aspects.
Yes, yes. And I just want to also say that this, I talk about patience and we kind of talk about that, but even customer service phone calls, they want to be felt like they're respected as a person too. So, how we manage those calls when they call in for help support is very vital too. Not just, when you think of healthcare, you kind of think about that connecting with the customer, but you need to connect with the customer in any relationship that you have with the customer and at any point in your relationship with the customer.
Right. Good point. In closing, are there any resources that you might recommend for our listeners?
Yes, actually, to me, the biggest aha was reducing pain points and effortless, and a great resource is a book called The Effortless Experience: Conquering the New Battleground for Customer Loyalty, and that's authored by Matthew Dixon and Nick Tommen and Rick DeLacy. But it really talks about a lot of the stuff that we were talking about, not wowing and not needing to wow. And, using measures, because I was talking about the scorecard, is using measures, not just survey type measures, but if for example, that there's a huge dissatisfier for customers who require support, that timeliness of resolution, if it takes too long, because they want their issue to be resolved quickly. So then something that you would put on this scorecard or dashboard that you would be looking at related to customer engagement is a measure of resolution time, the length of time to solve the problem. If safety is a key requirement for your patients, then you would have safety measures that you would monitor, such as the frequency of falls or hospital-acquired infections. So this whole effortless experience is identifying where the effort is, measuring how much effort are we making it for them, and then trying to dial that down. So that's kind of what I've seen, in my situation here and reading that's kind of the key these days is just making about the quality that you're providing and an effortless experience.
Yeah, I love that. Effortless. I love that. I'll have to pick that book up. It sounds good. All right. Well, thank you so much for spending time with us today, Debbie. This has really been very insightful from a customer focused perspective. We'll have to have you back. Thanks again.
Well, thank you, Laura. I always enjoy talking to you.
Aw, ditto. Thanks. Have a great day.
Thank you for listening to today's episode of Sterling Visionary Voices, Insights for Role Model Leadership from the Sterling Council. Discover more and connect with us at sterlingvisionaryvoices.com.